Restless leg syndrome, or RLS, is a creepy, crawly, weird sensation typically that occurs in the legs that's associated with an uncontrollable urge to move. This occurs at night when we're getting into bed, so we can't fall asleep. In addition, you can twitch or jerk during sleep, which can affect our bed partners. Both of these things can drive you and your bed partner crazy. At the Sutter Sleep Disorder Center, we see a lot of people with insomnia, a good portion of which are going to wind up with restless legs. It's easy to diagnose. It's just through a conversation with your doctor. You don't need a lot of elaborate testing, and you don't need, in most cases, to spend the night at the center. Restless legs can occur in any age group, but we typically see it in middle-aged women, as it's likely to occur in women much more frequently than men. So what causes restless legs? For the longest time, we thought it was a psychiatric problem because it is so weird. How could it be anything else but? We now know that it's a brain chemistry problem. One problem is the lack of iron into our brain. This is why a lot of pregnant women tend to have restless legs, because they are anemic and they run with low iron levels. But there's also a problem with a brain chemical, an important one called dopamine. Dopamine is needed for smooth muscle movement. If you don't have dopamine firing the right way, you're going to have weird movement, just like you can see with restless legs. Let's talk treatment. The good news is it almost always works. As doctors, we can offer iron if you're deficient, or perhaps a medication that boosts dopamine in the brain. These drugs are very effective and generally well tolerated. Behavioral changes that are likely to help might include some light exercise in the early evening, hot or cold packs on the legs, or warm or cool baths, maybe massage, a little yoga stretching. All this stuff really helps. Together with your doctors, we are likely to be able to treat the restless legs and make you more comfortable. Restless leg syndrome is one of the most common physical reasons why people can't sleep, but sadly enough, it is often not diagnosed. Patients either think it's too weird to bring up or are not aware of the effective treatments that their doctors have to offer them. So you need to speak up and get that conversation going with your doctor in order to get some relief, and then both you and your bed partner are going to get a much better night's sleep.